Hello again. As we enter the summer, and the kids go back to school, we start thinking about insurance. Okay, maybe I'm the only one. Whether you have an employer or self-employed, looking for the affordable care plans, or you're on retirement, it has now become common practice to renew your coverage this time of the year. So let's take a look at some of the things to consider whether you have retired or you work for someone. Now, since this channel is focused on retirement concerns, we will focus on retirement. But these considerations could apply to anyone before retirement. For what does one buy insurance for, especially health insurance? Do you buy an all-inclusive plan? That might be nice if they had one. Your employer offers different options when you sign up, but guess what? These are all separate plans. So why would you not consider or cover the same things when you retire? Does life magically change just because you turn 65? Well, let's talk about at least 4 areas of care after 65 that you should or ought to consider. A major difference between getting insurance after 65 and while you're still working is you're not planning for the next year. Oh, sure, you may be talking to Johnny Agent about a Medicare plan each year, but that's not all to plan for. See, there are issues to cover after 65 that you don't have before. You may be used to thinking about short-term and long-term disability, dental, vision, hearing, because you're still earning a paycheck and you can take care of yourself. The other concerns aren't as important. But after 65, maybe not immediately, you have to start thinking about how you're going to receive care outside of the hospital, especially if you don't have family or they don't live close. They can't bring themselves to take care of the needs you have, covering your daily activities of living, particularly, you know what I'm talking about. Some of my clients in the past had such poor health that I tried to put them on a plan that would cover as much out of the pocket costs as I could. They later passed, and I realized what they needed they had never thought of. By the way, you should listen to my podcast about home health care versus home care. It will be very enlightening. Many of my clients think because they are presently healthy and have been most of their life that they don't need to worry about the other areas. Well, maybe. Have you seen the life insurance commercial about the guy next door who dies and the wife tells the husband who turns and asks, "Are we going to have that we need to get life insurance conversation again?" You know the one I'm talking about. She says no and proceeds to have the conversation about getting the insurance. What have you heard me say repeatedly if you followed me? You don't get the car insurance after the accident. Point? So what 4 areas am I talking about? Well, there's acute care, skilled care, immediate care, custodial care. We'll skip the acute care. I would suggest you listen to either my podcast or watch the video on the channel about what Medicare covers. Once you do, you'll understand why these areas need to be covered to save you from high out-of-pocket costs. Again, we're talking about situations that could occur anytime after retirement and could make for a sudden and drastic change in your life. Skilled care, which is done by a professional, may or may not be covered by Medicare or your Part C. For example, if you're required to go to a skilled nursing facility but didn't stay in the hospital for the required time, the minimum of 3 days admitted, you may be responsible. On the other hand, if you were admitted to the hospital for the minimum 3 days, you would be covered. Let's say you fell and broke your leg, though, skiing. The doctor puts a cast on it and sends you home. For a couple of weeks, you can't walk. Then, you need rehab to walk again. Since you never were admitted to the hospital, you don't qualify. Therefore, Medicare wouldn't necessarily pay. Since it was approved by Medicare, though, you could be responsible for the whole amount. Since it wasn't approved, you'd be responsible for the whole amount of skilled nursing care. We'll talk about the costs of that later. Next, we look at intermediate care. This is more or less skilled nursing done in your home. This time, let's say you were admitted to the hospital, staying the minimum 3 nights. You don't need the facility care, but you do need to have a nurse take care of you instead of a family member. Technical stuff. Again, you should expect to pay for these services. Lastly, let's look at custodial care. Now, here you see this coming up late in life. People being forgetful and decrepit, unable to complete some of your daily chores. I'll go into more about that in my next video. I've got a friend that suffered a long time. The average is about 8 years that one suffers from this particular issue, and we'll talk about that more. Be it running to the store, helping you pay bills, clean house, these have all begun to be more than you can handle. Yeah, you will pay. Ultimately, these are high-level examples, but they are real scenarios. It also may become necessary to consider a care facility to handle your needs, or your care manager might just start making arrangements. Either way, while you are healthy and because the price of much lower when you're younger than if you procrastinate, you should be prepared. You should get thoroughly familiar with that Medigap or Medicare Advantage plan you have today. Then look for a plan for the method to cover your out-of-pocket expenses. Many plans will pay you back for these expenses, but only if you have one. Now there's a novel idea, right? You might want to check out my podcast I mentioned earlier and watch for my update to what Medicare covers again. Hey, thanks for visiting today. Hope you have a good rest of your day.